over the last few days. This morning, multiple areas of Delhi have recorded severe air quality levels, and through the day, the air quality levels have been dipping. Right now, the Central Pollution Control Board app says that the overall Delhi air quality is at 400, which is very poor category, just bordering on the severe category. At many places, the air quality index has crossed 400 mark, which the Pollution Control Board says can possibly affect even healthy people and seriously impact those with existing conditions. Areas like Anand Vihar, Ashok Vihar, Bhawana, DTU, Patparganj, more than 17 out of 35 locations where the pollution index is being recorded are in the severe category zone today. All right, let's take it to our panelists who are joining us to understand what we can do to guard ourselves against toxic air and what is the cause of this toxic air. Is it our bad days, worse days yet to come? Joining us this afternoon is Dr. Sanjeev Bagai of the Nephron Clinic. Also joining us is Vivek Chattopadhyay, Senior Program Manager at the Center for Science and Environment in New Delhi. Thanks very much, gentlemen, for speaking to us. Vivek Chattopadhyay, to you first. You know, pollution is at 400, the air quality index, just bordering on the severe category. You know, the capital virtually seems to be turning into a gas chamber. What are the reasons for this? Are the worst days yet to come?
See, the ventilation capacity is reducing day by day, and it's very less right now, and it is going to fall further by the end of this month. It's the dispersion capacity of the atmosphere has reduced very much, and the contribution sources are like local sources, vehicles, industries, and other sources. But on top of that, stubble burning, fire emissions has also like coming into the city, and since the air is stagnant, the pollution is accumulating very fast and it is not able to disperse. That is the reason like we are observing severe air quality in the city, and definitely it is going to get worse if urgent measures are not taken on the known sources in and around Delhi and NCR, and also the authorities should identify additional sources which are contributing to it. At the same time, it should be scaled up to the level of like regional level, including Punjab and other regions. Unless until we don't act on regional air quality, we will not see improvement very soon.
Dr. Bagai, you know, there is no escape from this air. We are forced to breathe this toxic, poisonous air every second of our life right now. So what can we do to guard our respiratory system, you know, so that it doesn't get impacted so much? Are there any solutions? Because we have to breathe this air. There is no escaping it, particularly people who work outdoors.
Good afternoon. I think the first thing is that the health of every citizen should be non-negotiable. And air pollution is the #1 cause. In fact, it should not be called as air pollution. It should actually be termed and labeled as a disease, because it's causing 7 million deaths every year globally, and more than 30 to 40% of this load is in India. It precipitates almost 60% of the non-communicable diseases, the cardiac effects, respiratory effects, bronchial asthma, neurological effects such as stroke, skin, eyes, mental condition. It in fact even involves the pregnancies and the unborn fetus. So the effect is multifactorial and in great magnitude. My advice to all the citizens is that don't wait for just the AQI to go a little bit up and down. What we are seeing is all through the month and many weeks now, we are seeing air quality which is bad and very, very damaging to health. Please wear a mask. Wear a double mask. It will prevent at least the particulate matter and some of the fumes from being inhaled. Do not go out when in the peak parts of the traffic, and the office goers, especially the small children, elderly, should avoid the very cold and the toxic smog early mornings and late evenings. Patients who are known patients of bronchial asthma or bronchitis or wheezing or allergies should take specific care, consult your doctor and be on an inhaler. And more importantly is any evidence clinically of breathlessness or feeling uneasy or unable to breathe or labored breathing or fainting or feeling lightheaded, please consult your doctor. Don't give any home remedies. What is important here to check is we very often check of PM2, 2.5, PM5. But the real effect is of the gases, the toxic fumes, the volatile organic compounds, the hydrofluorocarbons. These are carcinogenic. I dare say, and I really fear, that the next generation is going to be severely impacted neurologically and physically if we don't take real firm action. If you ask me honestly, and as a tax-paying, very, very honest citizen, any neighboring state which is indulging in crop burning is a criminal act amounting and precipitating death to the citizens of Delhi NCR.
Yes, you talked about crop burning. The farmers say we have not got any help from the government, so they have no solution. So that's a more complicated issue there. Ishika now joining us, reporting from the ground in the National Capital Region. Ishika, the city and the NCR region virtually turning into a gas chamber. We saw smog early this morning there in the National Capital Region. What's the situation there outside right now?
Yes, Rohit, as you rightly said that, the Delhi and in fact the Delhi NCR is turning into a gas chamber nowadays. If we talk about today morning, we told you that the average AQI level here was 393. Now, as of now, it has dipped again to 403. That means the average AQI level here in the national capital has gone into the severe category. If we talk about the, the stations, 36 monitoring station, 22 have gone into severe categories. We were talking, in the morning, telling you that the stations like ITO and RK Puram, both of them were in very poor category and they were on the verge of slipping into the severe category, and that is what has happened. They have also registered an AQI level, over 400 and have gone into the severe category. Now, what we are seeing on ground is that despite, so much of pollution, the small children are also forced right now to go to their schools. And we also talked to some of them. And what they are saying is that they are facing certain problems, be it, itching in their throat. And what they are requesting the government is that, till this, pollution, high level of pollution is there in the national capital, their schools should be closed. Now, on the other hand, the Environment Minister is saying that, he is taking steps. In fact, in the recent past, we also saw him taking a meeting with the DPCC, officials, where he said, more than 200 construction sites have been banned for not following the construction rules of pollution. And in fact, after all this, meanwhile, the politics on pollution is also continuously going on. The BJP leaders, specifically the Delhi BJP leaders, be it, Tajinder Pal Singh Bagga or in fact, Harish Khurana, all of them attacking the Aam Aadmi Party government, asking that, when after the Diwali we are seeing yet again the air pollution has gone to such a level, then who is responsible now? We definitely cannot blame the Diwali, but this is the failure of the Kejriwal government. They are also saying that, when the air quality is dipping day by day here in the national capital, the Chief Minister is busy in his political tours. Thus, they are saying that he is clearly running from his responsibility. Thus, what we are saying here, Rohit, is that, continuously it is, making insufferable for the Delhites to breathe in this toxic air. The politics and pollution is continuously intensifying in the national capital. Over to you.
All right, so politics continuing over there as Delhiites are forced to breathe this toxic air. Vivek Chattopadhyay, let me bring you in. Year after year, there are promises made. This year also, there was a 15-point action plan. There's a graded response plan for pollution. But something seems to be amiss here. Nothing seems to be working over here because the Delhi air quality is continuously dipping. Right now, it is the CPCB app tells me it is 402. So it has gone into the severe zone, the overall Delhi pollution. What's not working?
See, what is not working is like we are failing into taking action on certain key areas. For example, coal burning is a major issue. in entire Delhi and NCR and beyond. So fossil fuel is a major problem. Then our vehicle technology has, although improved, but number of vehicles have like increased tremendously in entire Delhi and NCR and beyond. There are garbage burning issue because the garbage management is very poor across the cities. Then we have many other sources which may not have been identified across the region. And one of the reasons that we are failing year after year is not able to find a solution to crop residue burning that is happening in the entire region during
crop
this
residue
period.
burning. Vivek, hold your thought there. Vivek, sorry to interrupt you there. Hold your thought there about the crop residue burning. We are getting this report that is coming in on precisely that, the stubble burning, and how serious that issue is. Let's in fact listen in to our correspondent Manoj.
पंजाब में भयंकर तरीके से पराली को आग के हवाले किया जा रहा है और इस वक्त हम मोहाली जिले में ही हैं और यहाँ हम एक और खेत में पहुंचे हैं जहाँ आप देखिए किस तरीके से जो खेत हैं पराली के उनको आग के हवाले किया गया है। भयंकर आग यहाँ पर लगी है और अगर आप मैं विजय को कहूँगा कि वो लॉन्ग शॉट लेकर दिखाएं कि किस तरीके से कितने बड़े स्तर पर जो पराली है वो यहाँ पंजाब में जलाई जा रही है और बहुत बड़ी मात्रा में जो यहाँ से धुआं उठ रहा है ये वायु प्रदूषण का भी बड़ा कारण बन रहा है। पंजाब के किसान लगातार पराली को लेकर सरकार से मुआवजे की मांग करते रहे, आर्थिक मदद की मांग करते रहे, यहाँ तक कि कृषि उपकरण देने की भी बात कही गई, लेकिन ग्राउंड पे जो हकीकत है वो आपके सामने है। ज़मीन पर कोई मदद नहीं पहुंची और यही वजह है अब जो पराली है वो पंजाब के खेतों में धधक रही और उससे उठने वाला जो धुआं है वो न केवल पंजाब बल्कि हरियाणा, दिल्ली और आसपास के कई राज्यों में वायु प्रदूषण का बड़ा कारण भी बन रहा है। और दिल्ली में जो कि हमने देखा कि पिछले साल जो स्थिति थी उस तरीके के वायु प्रदूषण का स्तर पहुंच चुका है। और पंजाब की अगर हम बात कर लें तो एक दिन में कल 28 अक्टूबर को 2000 से ज़्यादा पराली जलाए जाने के मामले सामने आए थे। अब तक 10,000 से ज़्यादा पराली जलाए जाने की घटनाएं पंजाब में हो चुकी हैं और अगले एक हफ्ते इनका और भी तेज़ी के साथ बढ़ने की जो संभावना है वो जताई जा रही है। तो ये पराली का खेत है, किसान धान की फसल काटता है और उसके बाद ये जो पराली क्या होती है दरअसल ये हम अपने दर्शकों को समझाएंगे। ये दरअसल अवशेष होता है, ये धान की फसल होती है, उसकी कटाई के बाद जो अवशेष बच जाते हैं इसको पराली कहा जाता है। और इस पराली को खेत से हटाने के लिए जो किसान है वो इसको आग के हवाले कर देता है और अगर इसको आग ना किया जाए, बिना जलाए इसको निकाला जाए तो किसान का ऐसा दावा है कि ये खर्च 5 से 6 हज़ार रुपए प्रति एकड़ आता है और किसान ये खर्चा अफोर्ड नहीं कर सकता है। और इस साल क्योंकि जो फसल की प्रोडक्शन है वो भी पहले के मुकाबले बहुत कम हुई है, किसान आर्थिक मंदी से जूझ रहा है, आर्थिक स्थिति उसकी पहले से ही बदतर थी और वो बद से बदतर होती जा रही है, इसलिए उसके पास कोई विकल्प नहीं बचा है। और इसलिए आप जहाँ तक देखेंगे कि वो पराली को जला रहे हैं, धुआं उठ रहा है जो वायु प्रदूषण का भी कारण है। साथ ही साथ ये दिखाता है कि जो पंजाब सरकार के दावे थे वो कहीं ना कहीं धराशायी हुए हैं, दावे हवाई साबित हुए हैं। यही मोहाली में आज पंजाब की सरकार किसानों को सम्मानित कर रही है कि वो पराली जिन किसानों ने नहीं जलाई है या वो ना जलाएं, लेकिन ज़मीन पर जब आप आएंगे तो आपको ये आग और धुआं मिलेगा जो सरकार के दावों की हकीकत बयां करती है। मोहाली से वीडियो जर्नलिस्ट
All right, Manoj, reporting there from Mohali. So Vivek Chattopadhyay, you were talking about this crop residue burning. You know, the farmers say that policies are made in the capital cities, but nothing really reaches the ground. So they say that they are helpless.
See, it's total failure of the governments, I would say. The failure of the state governments as well as the central government, that they are not able to find a workable solution to this problem. And every year, like promises are made that we will provide certain equipments or we will identify financial solution. Everyone has to sit together and it has to be taken seriously at the entire regional level. unless until we don't have strong laws like maintaining this air, like air quality basin, I would say the entire Indo-Gangetic plain, because it's not about Delhi. If you look at the data, entire region is affected. So I think that cost of air pollution has to be figured into like the way agriculture produce is procured by the government, it is managed, as well as
Right.
the way it is like farmers perceive the issue. So I think all have to sit together to identify the solution. Otherwise, this is becoming unmanageable issue.
Unmanageable issue. Dr. Bagai, I want to understand from you what are the direct impacts of pollution on your health? Because severe air pollution, according to CPCB, it says that it can possibly affect even healthy people and seriously impact those with existing diseases. Now, I want to understand what do the studies show? What are the direct links from pollution to your health?
Okay, the key question. So there are enough publications in the international domain which are peer-reviewed and randomized controlled trials which have been done. Neurologically, it causes depression, strokes, intracranial bleeds, dementia, Alzheimer's. Respiratory system, it causes acute bronchitis, wheezing, cardiopulmonary and metabolic disorders, acute exacerbation of bronchial asthma and allergies, cardiac-wise, hypertension, arrhythmias, acute cardiac arrest, myocardial infarctions, skin, eyes, chronic obstructive pulmonary diseases. It causes stillbirths, premature deliveries as far as pregnancies are concerned, fetal abnormalities. So this pollution in terms of volatile gases and hydrofluorocarbons which are contained in the gases are carcinogenic. It damages your DNA and chromosome. Children are now born with congenital errors and congenital defects, obesity, hypertension, bone disease, and more important, and not to mention in the last, is cancers. Respiratory cancers, liver cancers, neurological cancers, and a host of other carcinogenic compounds. So we know that it can impact short-term, mid-term, and long-term. There are international studies to show every 10% increase in PM 2.5 and 5 causes 10% escalation of death. There are also studies to show an average human being in metros like Delhi would tend to lose 8 to 10 years of their adult life in terms of longevity. And this is ridiculous. Why are citizens tolerating this? Incompetence of the state governments cannot impact people's life, and people in Delhi are not willing to die because of false promises, especially in states like Punjab.
Yes, pollution should in fact be at the political center of the political discourse, and some concrete measures clearly need to be taken over here. Vivek Chadha, you talked about some urgent measures that need to be taken. I want to know, what are these urgent measures? Do you think the odd even, for example, should be brought back? Will that help? Or should people be told to work from home? Because that we have tested that method. That method works for most of the organizations. Should people sit at home and work from there so that the vehicular pollution should be reduced? What are these urgent measures are you proposing?
See, the non-essential travel definitely can be reduced a lot, and wherever the work from home is can be permissible, it should be allowed. Carpooling should be advised. Odd and even has to be done if severe conditions remains for a longer period of time and it is forecasted in that manner. Definitely, we now have identification system of diesel vehicles also. So the measures should be taken to stop the diesel vehicles, particularly the polluting ones, the older ones, and at the regional level, identify the power plants which are not adhering to the emission standards, and they have to be closed down if the power can be managed in such a manner at a regional level. Then the industries which are not meeting the norms, they should be inspected and closed immediately. And non-essential like transport, goods transport should be can be halted when the severe plus conditions goes, although it is still far away. We are not in the severe plus category. So all these measures have been identified in the CAQ, the Air Commission's report, and Delhi government as well as other governments have prepared such plans. But somebody has to coordinate and monitor it properly. Otherwise, if we leave it to the authorities itself, they will not be able to implement it. So I think at the central level as well as at the state level, the task force should work together to enforce the measures already identified, and additional measures should be taken if necessary, which may be harsher for a period of time. Well, there is no other way to to reduce the pollution right now.
Yes, measures have to be taken. Task force should be working, but I don't think anything is working here. We saw that the Delhi Chief Minister was saying that the pollution is better post Diwali compared to last year's. But still, Delhiites are breathing poisonous air. This is bad air that Delhiites are forced to breathe day in and day out in this weather condition. Dr. Bagai, have you seen increase in respiratory complaints over the last few days? And I want to understand, you have said that you should wear mask, so that the pollutants are not going inside your respiratory system. I want to understand, when do you think that a person should consult a doctor? When is it that we should go to the doctor? What are the symptoms we are looking for here?
Yeah, so the most vulnerable age group is children below the age of 5 or 7, the elderly is beyond the age of 60, patients of all categories and all ages with comorbidities, especially with known history of cardiac ailments or respiratory ailments and asthma. At my own practice, I have seen almost 100% increase in cold coughs, fevers, wheezing, bronchitis and asthma exacerbations in the last week or so. But having said that, I think what is important as a carry-home message is that if you have difficulty in breathing, especially the smaller children, because the symptoms are very often hidden and masked, if a child is not feeding well, if the child is having vomiting or is not alert, consult a doctor. For the elderly, a very simple thing would be, if you're breathless, just check your pulse oximeter. If it is showing any variation or any dip, consult your doctor. The worst thing you can do is start home treatment or home oxygen and things like that. Do not self-medicate. Do not take any antibiotics unless until it is really required. Reach out to a medical help. In the end, what I would really like a suggestion given to the government is we need a department of controlling pollution. It should be a department to fight pollution. It's a separate vertical. You need separate think tanks. You need separate technology, separate level of intellect. The skill sets are different. We need to take this on a war footing. We will continue to lose human lives. We will continue to lose small unborn babies. We are going to be generating the next generation, which is poorer in health. Is this what we work for? No. Is this what we ask of the politicians? No. Is this what we demand from them? No. We want true promises which are fulfilled. Mr. Kejriwal, message for him. Get it together, get the act together. We are not willing to die. Punjab fires are killing us. The road dust is killing us. The industrial fumes are killing us. There is no public transport worth its salt in Delhi. There is lack of buses. We need a more streamlined action plan to safeguard health, save lives.
All right, that's an important message there, Dr. Sanjeev Bagai and Vivek Chattopadhyay. Thanks very much for joining us. We need urgent measures, streamlined measures to get that air levels, the pollution levels down, and the air should be breathable. For Delhiites are breathing this toxic, bad and poisonous air day in and day out this season. Thanks very much, Dr. Bagai and Mr. Chattopadhyay, for joining us with your perspective on this rather concerning bit of news about Delhi pollution.